Right, shalom. First, I'd like to give all praise unto Yahweh Shem Yahweh Shai, and double honors unto the elders at Great Millstone, and honors to you brothers out there in the highways and the byways teaching this word in all sincerity and truth. Okay, it's the brother Rakaya Kwam, and here with the brother Rakama Kapash, and we're just gonna go into the Ebola scare slash pandemic and the ensuing mandatory vaccinations, global mandatory vaccinations, and what that would mean for the implementation of the RFID chip. All right, because it's funny when the whole thing when it came out with the Obamacare bill and it had the Type 2 medical device, which is the implantable chip in there for what was it for again? It's for statistic and tracking and recording information, and monitoring and all that shit. And when we here at GMS push that, showing you that's gonna be part of the plan to bring in this mark of the beast. You had 1,000,001 scoffers and their mother. The top scoffers were Bakwash and fools like this talking about how the May whatever came and the chip ain't here, which we never said the chip is gonna come on that day. We're gonna say it's gonna be law on that day. Just like they've got all these executive orders. The day they did the NDAA, did they start using it? No, but are they going to use it? Yes, they have a planned time that they're going to use it. Just like they got a planned time to use that facility in the Obamacare. Now, you got the healthcare system under the strain of a pandemic will collapse. So the government are going to have to take on control of it anyway. So that's your Obamacare, right? But we see now that it's very possible and likely that they're going to use the mandatory vaccines as a way of getting people to take that chip. And then the elders specifically said, look, they're going to take people to take it in groups, like nurses, doctors, police, military. And it's exactly the way this pandemic is starting off in the West is exactly like that. Like the danger groups are those type of people, like the nurses, the doctors, the police that went into the thing, the military, because the military are over there now. And those are the groups that are going to be targeting because they're catching it now. So they're looking for a way out. So when that vaccine comes out, they're gonna be the first people to take it. They're gonna want to take it because they don't want to drop dead or whatever. And basically, they're gonna say, "Look, you're gonna have to take this chip." And you telling me that they're not gonna take the chip, if it means to get that vaccine to possibly save their life from a deadly virus? Of course they are. Now, let's get Revelations 13 and 15. It says, and he had power to give life unto the image of the beast, that the image of the beast should both speak and cause that as many as would not worship the image of the beast should be killed. So basically, anyone that don't get down with the New World Order program, which part of that program is to be chipped under the system, they should be put to death. Now, in Revelations 13 and 16, which basically you're a terrorist, by the way. If you're against the New World Order, you're a terrorist. You're a conspiracy theorist. Revelation 13 and 16, and he causeth all, both small and great. Okay? So whether you're famous, he ain't talking about small nations and great nations. He's talking about small as in you're a small person, small in the world. So whether you're a nobody, average citizen, or great, meaning you're a celebrity.
Esteemed, yeah.
Esteemed. Rich, meaning you got money, or poor, which is the average man. Okay, free, meaning you're so-called at liberty to walk up and down the streets. Or bond. A bond is an inmate, a prisoner, which the prisoners are gonna get chipped and vaccinated. That goes without saying, right? To receive a mark in their right hand or in their foreheads, that no man might buy or sell. Buy or sell represents commerce. Which represents interacting with the whole society, because the whole society is based upon commerce. Anything you do in a society is based around commerce. The healthcare, anything, it's all transactions. Okay? That no man might buy or sell save he that had the mark. So you ain't going to be able to buy or sell. You ain't going to be able to get your rations. You ain't going to be able to get your healthcare. You ain't going to be able to pass checkpoints to travel, because you pay to travel. or the name of the beast, or the number of his name. Okay? And that's the RFID chip. Now, we've got this article here. It says, NIH, which was the National Institute of Health in America, says we may have to vaccinate whole countries to stop Ebola outbreak. So they're already preparing you that they're going to push a vaccination for whole countries. Now, that's a major program. That's a major program. Okay, it says 2 days ago, Dr. Anthony Fauci, director of the U.S. National Institute for Allergy and Infectious Diseases, told the Canadian press that it's quite conceivable, if not likely, that fast-tracked Ebola vaccines may have to be given to entire countries to get the viral outbreak under control. Because as you can see, on purpose, they are letting the outbreak get out of control. Like using stupid shit like fever scanners and shit that ain't going to do nothing, basically. And they're also giving it to people. They're going to give it to people in flu vaccines and all kind of shit. So they're going to cause it to get to where hundreds of people are dead in America, or thousands of people in over the next 2 months, right? More than likely, that's what they're looking to do. They're going to cause, because they already done said up to 10,000 people infected. They're going to cause that scare as a pretext to start mandatory vaccination programs. But we all know that it's not just the vaccination, it's also the chip. How do we know? Well, we'll show you anyway. It says, as the epidemic gets more and more formidable and in some cases out of control, it is quite conceivable, if not likely, that we may need to deploy the vaccine to the entire country to be able to shut down the epidemic. That is clearly a possibility. Okay? Alright? And then there's talk of the UN basically, if a country decides they don't want to be vaccinated, the UN forcibly going in there and vaccinating them. You know, I saw an article about that too. We got another article here. Okay, which shows that it's being proliferated, saying a second person is tested positive for Ebola in Dallas. Another nurse, so these nurses are being targeted, and then her boyfriend is on the quarantine. He could be one, and then she was on a plane the day before. Okay, so that's all the people at the airports. They're gonna want to get that vaccine. Now, we'll leave that bit. This is an article that I found called "From Hell to Veins." FDA approved RFID chips for school children, the vaccine connection. Now we're just going to read through this. It says, the so-called skeptics of the ever-growing anti-vaccine global sentiment have scoffed and laughed at the very real notion that those who control governments globally want the population tagged like cattle with some form of RFID chip. We know that to be the mark of the beast. So that's scriptural. That's prophecy. This is what's going to happen. As a matter of fact, the Bill and Melinda Gates Foundation, which we know that full bill didn't come up with Microsoft, okay? He's just the front man. And that's why he has to use his money on what the elites say. And he donates all the money to these things. Population reduction and also RFID. It says, as a matter of fact, the Bill and Melinda Gates Foundation has spent millions, maybe even $1 billion, on this RFID vaccine tracking endeavor. Okay, so that goes into that type 2 device in the Obamacare. Okay, see, so all these dots are going to connect. Recently, courts have ruled against the sovereignty of the parent and child by allowing schools, mostly if not all government schools, off the hook after forcing vaccines into the veins of children with vaccine exempt status. These types of actions by government, in this case the federal courts and the federal schools, are the very bellwether of tyranny, always disguised as the greater good. Okay, so they go, oh, we need to get all these people vaccinated and chips for the greater good. No, it's because they're tyrants and they want control. Alright, now it says, how does this tie into the RFID tracking chip the Bill and Melinda Gates have invested so much money in? Here is the FDA's very own position on the RFID chip as it is applied to human beings. Alright? And again, remember, this is in the Obamacare. It says radio frequency identification. We all know what it is. They go into a description. Let's go to uses, because Nate said Where's my dark?
Yeah.
RFID systems use radio waves at several different frequencies to transfer data. In healthcare and hospital settings, RFID technologies include the following applications: inventory control, equipment tracking, out-of-bed detection, and fall detection. So that's your tracking. They can track them in the hospital on, you know. Personnel tracking, track the nurses, so forth, know where they are. Ensuring that patients receive the correct medications and medical devices. Again, preventing the distribution of counterfeit drugs and medical devices, monitoring patients. Okay, so you give them the vaccine and you can monitor them using the chip. Providing data for electronic medical record system. Again, so this is all built in. The FDA is not aware of any adverse events associated with RFID. However, there is a concern about the potential hazards of electromagnetic interference to electronic medical devices from radio frequency, blah, blah, blah. Okay. Information for healthcare. You gotta go. Alright.
Yeah, man.
Shalom.
Alright, shalom.
So, yeah, man. So basically, what it is there is they're already done approve the RFID use, man. Okay, so it says note the heavy emphasis on this RFID technology being used for tracking records. The way these new universal healthcare systems, both the US and now the UN laws are written, make it clear that in order for you to get your universal healthcare, your medical papers must be in order. It ain't gonna be no paper. This is the very reason why major vaccine investors such as Bill and Melinda Gates would fund this technology in the first place, as this 2009 article below demonstrates that indeed they do fund. And this is called RFID tracks infant pneumonia in Pakistan. So they've already tested this out. Alright. And go to the article. It says here, RFID tracks infant pneumonia in Pakistan. We've written frequently about the increasing use of mobile technology to provide basic health services in developing countries, but often we're talking about nothing more advanced than text messaging. Well, this time the technology is significantly more advanced. More than 4,000 infants in Karachi, Pakistan are wearing RFID-enabled bracelets as part of a study to measure the incidence of pneumonia. It's a passive RFID system requiring health workers to scan the bracelets with PDAs or mobile phones when the children come in for immunizations or well baby visits. But it also has improved physician response time whenever one of the tiny patients exhibits symptoms of pneumonia. As a bonus, a central server holds each baby's medical records. So you see, the program called Interactive Alerts for Childhood Pneumonia was designed in part by John Hopkins Bloomberg School of Public Health and is funded by a Bill and Melinda Gates Foundation grant. So they already been testing this out and pushing it out there, man. And Bill and Melinda Gates, check this out: 131 children vaccinated at gunpoint in Malawi. Okay, and it says here about 131 children from Nsanje who fled into neighboring Mozambique during the anti-measles vaccine a few months ago, which this was back in 2011, man, were vaccinated this week at gunpoint. Because in Africa, them people, they'll be running from these vaccines because they know they drop dead. And that's how that Ebola got over there. But they test this shit off over there in Africa and different third world and developing countries. The children belonging to Zion and Atumwi churches were taken into Mozambique by their parents to hide them from officials fearing they might be vaccinated. According to Dr. Madison Machaya, District Health Officer for Nsanje, medics went to vaccinate the children in Nsanje under police escort. So that's gonna happen, man. People are gonna resist and they're gonna be forced at gunpoint. It's not no joke, man. You don't want your kids, they might take your kids. They will take your kids. Listen to this. Swine flu. This is back in 2009. See, what I'm trying to show you is they've already prepared for this, man. They've done the trial runs. Swine flu vaccine recipients could be tracked with RFID bracelets using Big Brother medical technology. Okay? So, and that article, the headline says it all. Okay? Now, this is at the bottom of the article. Alright? It says the worse the pandemic gets, the more aggressive these actions will become. Right? So, you know what? Let me. You know what? This article is beautiful. Let me read this, man. Forget it, man. We're gonna read this. Let me start from here. It says here, here's the scene from some dark present-day action movie. David Balfour breathed hard. He could hear the thumping, blah, blah, blah. So this is from a movie, right, that they created. Like, and I'm going to just read the scene at the movie. Now, Boston police open up. So the police banged on the door. They were like, open up. You can read it for yourself. Mr. Balfour, the police shouted, you have 10 seconds to open this door or we are coming in. They were bluffing, pretending he wasn't home, blah, blah, blah. Mr. Balfour came the voice in authoritative tones. You have refused to wear the Vaccinations bracelet as mandated by the National Pandemic Protection Act. And as we cannot determine your vaccination status, you are considered a danger to the people of the city. Now, this is from a movie, man. Damn, what movie is this, man? Damn, it's crazy. But this is crazy. It says, you have 5 seconds. There was no way to fight this, he realized. So David reached out to the door and began to slide the locking mechanism open. Bam, the door burst open, striking David across the chest and forehead, fingering him, blah, 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 blah. They grabbed his wrist and forced his hands behind his back to be painfully handcuffed. He blah, 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 blah. Now the doctor comes in and says, I'm Dr. Argosy, blah, blah, blah. Mr. Balfour, you are now going to receive an FDA-approved H1N1 vaccination and to be fitted with a Vaccinations bracelet. Please remain calm, which really ain't gonna be no bracelet. So this is what it has come to. He thought, face down on the floor of his own home, a squad of vaccine enforcers standing on his back, a pair of handcuffs, a shattered front door, and a probable black eye, and the doctor hidden from view, about to inject him with something he knew couldn't possibly be safe, man. Now, it says here, before leaving, one of the police officers leaned close to him, almost whispering in his ear, and don't try to take off your Vaccinations or we'll know and we'll have to come back here. Now, obviously, we know that they ain't going to give you no damn bracelet. They're going to actually inject it into your hand, so you ain't going to be able to get rid of that shit unless you cut it out, and they're going to know, okay? Now, this is supposed to be from a film, right? But it says this may not be fiction for very long. The above fiction account may not remain fiction for long. Late last year, the city of Boston began fitting vaccine recipients with Rfid tracking bracelets, allowing health authorities to visually track the vaccine status of city residents on a large digital map. This map shows the location and status of anyone wearing an RFID tracking bracelet. Sound familiar? The movie Contagion. Thereby revealing areas of the city where vaccination rates are low too. By identifying these low vaccination areas, city officials could roll in with mobile vaccination units and law enforcement personnel, then march door to door vaccinating and tagging residents either voluntarily or at gunpoint, depending on the circumstances. It is perfectly legal, by the way, under Massachusetts laws that are being put in place right now to handle the expected swine flu pandemic. So they bigged up swine flu. The swine flu ain't really nothing at all, period, point blank. And he was pushing these ideas and these legislations through, and now you have Ebola, which is a real danger. So they can use it. It says here, it says the RFID vaccine tracking technology isn't fictional. It exists right now and was reported by the Boston Globe, which revealed that the vaccine tracking bracelet trials were in place nearly a year ago. Several hundred people are expected to queue up for immunizations at the headquarters of the Boston Public Health Commission, the Boston Globe reports. Each of them will get a bracelet printed with a unique identifier code. Information about the vaccine's recipients and the shot will be entered into handheld devices similar to those used by delivery truck drivers. The effort, says the Boston Globe, is aimed at eventually creating a citywide registry of everyone who has had a flu vaccination. The resultant vaccination map would allow swift intervention in neighborhoods left vulnerable to fast-moving respiratory illness. This is an open admission that the kind of scenario depicted in the fictional snapshot at the top of this article could potentially become reality. Swift intervention means rapid-fire vaccinations, which is, they're saying they got 60 days to get this thing under control, otherwise they're going to have to do something drastic. And people who resist these vaccines aren't going to have much of an opportunity to say no. The worse the pandemic gets, the more aggressive these actions will become. If people start dying from the pandemic in large numbers, the vaccine squads are likely to be out in full force. And they're saying they got to have Ebola response teams now, injecting victims and at road checkpoints and possibly even in their own homes via door-to-door sweeps. People who refuse to be vaccinated can be legally arrested and detailed by authorities, and to use the exact terms that are about to be passed into the law en masse, they can be involuntarily transported to a quarantine camp, FEMA camp, death camp. Almost sounds like fun, huh? A free ride, free food, free showers, oh yeah, and a free vaccine shot too, courtesy of the state. Now, your papers please. It says, beyond the Rfid tracking technology, there's another disturbing development you need to be aware of. Law enforcement all over the country are now reportedly being briefed about the possibility of vaccine checkpoints. See, so this thing, man, these could be set up on key roads and highways, and people passing through these checkpoints will have to prove they have been vaccinated, or they may face being arrested and involuntarily transported to a quarantine camp. Of course, it might not take much documentation to get past the checkpoints. There's no formalized vaccine ID card that exists yet, so a letter from your doctor, blah blah blah, will likely be sufficient unless they actually mandate vaccine tracking bracelets for everybody, which is what they're gonna do. That's what they're gonna do. I'm also not too sure that the masses of America's sheep will be willing to wear RFID bracelets that report their real-time position to US government. They will if they're scared to death. They will. Fair. It's just a little too close to being barcoded like a Jewish prisoner, but they're going to take more than a bracelet. They're going to take that chip. Anyway, let's move on. Right, now, another part, it says the Ebola vaccine is not being tested against Ebola. And you can read about that article. I'm not going to go through it. But they ain't even got this vaccine that they want to give people. It's not even been tested. It's not about the vaccine, man. It's all about getting you to take that chip that's going to come with the vaccine, man. Alright? And then I just wanted to do a quick thing just to show you, man. That's the World Health Organization's logo. All these health organizations, they're satanic, demonic, one world order organizations, man. And they're moving towards that plan. Okay, that's the caduceus and all kind of other wicked satanic symbolisms in there, man. Alright? So, hey, man, you gotta watch out for this thing. You gotta keep your eyes shut, because they're saying, what, 60 days? They're saying 60 days, man. Or this thing's gonna get out of hand. And they're gonna let it get out of hand. According to what you people believe, it's gonna be out of hand. So they can give you that forced vaccination and that RFID chip at the same time. Okay, and you see how it's been warming up. The article I was just reading it from Natural News was way back in I believe the original article that they were quoting from there with the Boston, I think that happened before. Give me a second here. That's way back in 2009. So come on, man, they done been getting this thing ready. Alright, so that's just some information I wanted to put out there for the brothers, man. The mark of the beast is close, man. And it's like the elder said. And these nurses, they're going to be dying to take that chip. They're going to be the first. The nurses, the doctors, the police, the military. And then they're going to get the children for the schools and so forth. And you people. You better believe that. And the elders done been saying that, because the elders are the prophets, man. That's the word of the Lord. While you other scoffers have been talking shit. Okay, and you're going to have all that terrorism and all that stuff there. That's another reason they're going to need to chip and track everybody. Because the chip is multiple purpose. But there's different ways they're going to get you, convince you, the people, to take it. Alright, so with that, I'm going to say shalom.